Health. Sonoma County's order will remain in effect until at least January 9th, 2021. We recognize that these stay-home orders represent challenges and difficulties for all of us, parents, employees, business owners, teachers, children, all of us. But they are a necessary response to the very disturbing increase in COVID cases and hospitalizations that we're seeing here, throughout the state, and throughout the nation. The state is up to 63.9 COVID positive cases per day per 100,000 residents, and statewide ICU capacity is down to 5.7% availability. We have had 15,096 total cases in Sonoma County, and our average number of cases per day has doubled over the past 2 weeks. Overall, in Sonoma County, we remain in the purple tier within California's blueprint for a safer economy. Our adjusted rate of daily cases per 100,000 is now 24.1. Our unadjusted rate is closer to 35. And the adjusted rate is up from 17.9 just a week ago. The county's testing positivity rate overall is now at 7.1%, which is up from 5.7% a week ago. And our equity metric remains at 10.6%. These increases remind us that we are in the darkest days of this pandemic. Nevertheless, we're really encouraged by the rollout this week of Pfizer's COVID vaccine, which will give us a much needed tool to fight the pandemic and eventually return to normal. Sonoma County's vaccine shipment is expected to arrive tomorrow. The shipment will come in 5 boxes with 975 doses in each box. They will be disseminated to 6 local hospitals on a proportional basis, giving each facility an equal share of doses relative to their size. As I shared on Monday, they'll be distributed as follows. 1 box will go to St. Joseph Health for Memorial Hospital in Santa Rosa and Petaluma Valley Hospital. 1 box will go to Kaiser Permanente. 1 box will go to Sutter Health, Healdsburg Hospital, and Sonoma Valley Hospital. And 2 boxes will be with Sonoma County Health for Aurora Mental Health, Crisis Stabilization Unit, first responders, and others in behavioral health that qualify under Level 1A Tier 1 prioritization. The second shipment of Pfizer doses is expected to arrive the week of December 21st. Sonoma County will receive 3 boxes of the second shipment with a total of 2,925 doses. Statewide healthcare systems, including Sutter Health, Providence, St. Joseph, and Kaiser Permanente, will receive their own shipments for distribution to their local hospitals. We also expect to receive our first shipment of 5,800 doses of the Moderna vaccine as soon as next week, pending its emergency use authorization by the FDA later this week. The vaccine at first will go to those in the priority 1A Tier 1 group, and that includes healthcare personnel, including those who work in hospitals, long-term care facilities, outpatient clinics, home health care, pharmacies, emergency medical services, and public health workers in essential and critical industries. This priority 1A Tier 1 group also includes long-term care facility residents, including skilled nursing facilities, assisted living units, and other residential care facilities for the elderly. Hospitals, healthcare systems, and community clinics will administer vaccines in compliance with federal, state, and county requirements. Federal authorities also have created a partnership with our pharmacies, CVS and Walgreens, to disseminate the vaccines through mobile clinics to nursing homes and care facilities. The county will be following prioritization guidelines established by federal authorities, including the Centers for Disease Control and Prevention and the California Department of Public Health. We will continue to share information about vaccine distribution as it's available. For the latest vaccine information, we encourage people to visit the websites of the CDC, California Department of Public Health, and our own website here in Sonoma County, socoemergency.org. I also want to underline that as we implement and roll out this vaccine, everybody still has to follow our mitigation measures of facial coverings, social or physical distancing, and general hygiene measures, just to keep the community safe. Thank you. We now have time to answer your questions.
Great. Thank you, Dr. Mace. The first question comes from a member of our public, Natalia, and she's, like many, is asking about, or Andrea is asking about the, what is our ICU? We know the whole region has dropped below 15%, but what is our ICU capacity at this time? And when we talk about ICU beds, are we talking about total beds or staffed beds? What do you think?
So I think we have Kate Pack, who's on with us, that might be able to respond to that. And we also have our EMS partners. That would be Brian Cleaver and Carly Sullivan.
Hey, as of today, we have 35.4% ICU capacity in Sonoma County. And with the question around what beds those include, those are ICU beds that are currently staffed or could be staffed within regular resources, that it would be easy to bring somebody in to staff those beds. And I don't know if Carly, if there's anything else you would add to that.
No, I think I'm okay. Thank you.
Okay. All right. Thank you. So just to make it clear that that does not include surge capacity, which is another category for the local hospitals. The other question is, there's a now that we are in a stay-home order is in effect for Sonoma County. There's been some questions about complaints to the staff line, whether those are being followed up on. Anne was asking, how do we know whether they've been followed up on? So that is still operating. I don't know if there's anybody here that wants to address that. I suppose I could if nobody else wants to. But I can't speak for our code enforcement team that they are very much responding to those calls. We've seen a significant increase since the stay-home order has gone into effect of people calling with concerns about non-compliance by businesses or large groups. I don't have the specific number for today, but I know they've gone up to as many as 130 in a day. So, but just to remind those viewers that the tip line for Sonoma County is 1-833-SAFE-707. That's 1-833-SAFE-707. And that's the number to call if you're seeing behavior that's concerning to you. And those will be directed to if they're in an incorporated area, they'll be directed to those cities, or our own code enforcement team will respond. Anyway, let's go to members of our media. Let's go to Ted Williams. Ted, good afternoon.
Hey, good afternoon. A couple of questions. One, I've been getting some feedback from some of my listeners about the difficulty in getting into the LHI website, that they don't retain any of the basic information, the client, and they have to go through all the rigmarole to get through. And then once they get through all that, the sites that are available for the testing are several days away and far away. Is there any reason why the LHI sites are so difficult to get on for a testing?
Yeah, thanks for that question, Ted. We can certainly reach out to the state. I want to remind people that the OptumServe sites, we have 2 lanes in Windsor, 2 lanes in Petaluma, and 3 in Santa Rosa are state run and state staffed. So we can certainly relay to the state that there are some delays in getting through, and that it would be nice if people's information was stored so that when you register again, it would self-populate. We'll certainly get that across. I do think that, like many other organizations, are having some staffing issues with since they added 3 lanes for Sonoma County in the past couple of weeks. So we're hoping they'll straighten those staffing issues out, and we'll be back able to offer test appointments more quickly. That is, if the state would be able to, but we'll certainly relay it to the state.
Great, thank you. And then with the ICU numbers, there was a lot of concern about number of ventilators early on. Does an ICU available bed equal a ventilator available in case that person is more critical?
Yeah, not necessarily. The ventilator numbers are different than the ICU bed availability. I don't know if Kate, you want to address that, but we are tracking the number of ventilators available as well. That has not been an issue here in our county. Kate, do you have anything to add?
Yeah, I would just note that as we are revamping our hospital capacity dashboard, if the public wants to monitor our county ICU metrics, as well as some key metrics from the Bay Area, you can visit the local metrics tab of our reopening dashboard. And those numbers are updated daily, and that includes the percent of ventilators that we have remaining. We have, and I don't have the exact number in front of me, but I know it's over 60% of our ventilators available.
Great, thanks so much. And thank you, Dr. Mace. I'll let other people ask.
Okay, great. Thank you, Ted. Another couple questions from the public. Do we know if, given our current state of situation, our hospitals, whether non-emergency surgeries are being limited? This question comes from Laura in the public.
Yeah, each hospital has looked at its own situation regionally, and I know that a few of our hospitals are actually limiting the non-emergency surgeries at this time. And if we see a worsening in terms of more hospitalizations, I'm sure that they will go back to where they were potentially last March or April, where they stopped doing those surgeries altogether. But right now, our hospitals are reviewing their own census and their data and making those determinations appropriately.
Okay, our question from Crystal in the audience asks, makes note that there was a report today of a nurse in Alaska who went into anaphylactic shock after receiving a COVID vaccine, just asking whether we know of other side effects from the vaccine or any other concerns that we know of at this time.
Yeah, let me turn that over to Dr. Baldwin, who's leading the vaccine effort.
Hello, good question. We also heard about that report from Alaska. That wasn't a reaction that came up in the clinical trials. So that's exactly why there is continued monitoring as people are continuing to get the vaccine and it's being more widely administered across the nation. I think it's good to put it in context a little bit. Every vaccine that you've ever received has that potential, and a lot of medications have that potential for an anaphylactic reaction or a severe allergic reaction. And only the adverse reactions are being highlighted. There's many people who have received the vaccine already in the United States and that have not had any adverse reactions, and those aren't reported. So it's kind of hard to tell if this is a frequent thing or not. We're only hearing about when something happens. So that's certainly something we'll be looking at. The state will be monitoring, and the CDC has a very robust adverse event database where they will be looking at that too. Is it a larger number of people having adverse reactions with this vaccine versus other vaccines versus what would be expected, or maybe not? So it's hard to say right now if this is going to be a recurring thing, or are we only hearing about the rare instances that it actually happens. Yeah.
So mainly the caution is being given to those who have had a history of severe reaction to vaccines, but not to others necessarily. Okay, let's go to Julie Johnson from the Press Democrat. Julie?
Hi, thank you. Dr. Baldwin, I'm hoping you might be able to say how many people in Sonoma County are in that Tier 1 category in line for the vaccine, and how long you think it might take to vaccinate that top group.
Yeah, Julie, I actually received that email that you sent, and we are writing down the numbers as we speak. So I think it'd be best, if it's okay, if I can just email you the numbers.
That's great. That's fantastic. Okay. Thank you for doing that. And if I may ask a up question. I understand vaccinations for at least some long-term care facilities will be handled by the Pharmacy Partnership for Long-Term Care program. And I'm wondering if you know the timeline on that program, when it might start. And then also, it sounds like some long-term care staff and residents might receive vaccines through the doses the county receives. And so I'm wondering how that's to be decided.
I can start that answer, and then I'll if Lindsay, our immunization coordinator, wants to add anything, feel free. Yes, we are. We've heard from the state that federal pharmacy partnership should really kick into place the week of December 28th, and that they should start implementing that vaccination program to the long-term care facilities that week. That's what we've been told. That's the latest we've heard as of earlier this week. So in the next couple weeks, they should be reaching out to the long-term care facilities to set that up, that vaccination plan up. As far as vaccinating, public health vaccinating, I think was the question. Some of the staff and residents at long-term care facilities, we'll see who did not enroll, who did not register for that federal partnership, and work with them individually on how to make sure that their staff and residents get vaccinated. But we're hoping, and we know that most of our long-term care facilities did sign up and register for that program, so we think that's how they will be getting vaccinated. Anything to add, Lindsay?
Yeah, I would just say that we're going to be monitoring the rollout of the vaccine in our long-term care facilities, and monitoring very closely how that does play out with the federal pharmacy partnership program. The majority of facilities in our county have enrolled, so we'll be working, if any did not enroll in that program, then we will be working with them. And then obviously this is a high priority population, and we want to make sure that we do get vaccine to them. So we'll be monitoring the rollout with the federal pharmacy partnership program, and working with facilities kind of as that unfolds to make sure that we can help to facilitate good coverage in that population.
Great, thank you. And very quick follow-up, do you know what the population of that group is, the staff and residents of those facilities?
The residents, it's a little difficult. I can tell you about how many beds there are, because residents come and go. That's a day-to-day, a moving number. I think there's around 2,048 skilled nursing facility beds and 3,468 residential care facilities for the elderly beds. But how many actual patients or residents they have is a little bit of a moving target. As far as staff, I'm working with Krista Barnett Nelson, our ombudsman for the long-term care facilities, to get that exact number of staff.
Great. Okay. Thank you, guys.
Okay, maybe we could direct this next question from the public to Lindsay while we have you on the line, Lindsay. Loretta asks, do we have any information about when teachers will be in line for the vaccine?
So teachers are, I believe that, so right now we're looking at healthcare workers and long-term care facility residents. Teachers, our essential workers are going in which teachers would be a part of, are going to be not, I don't have it right exactly in front of me.
I believe they're in tier 1B.
Okay,
I think they're 1B, yeah.
Yeah, there's a lot of different kind of tiers and phases. So 1B is in the subsequent rollout phase. So hopefully not too much longer, but we are still working through our phase 1A tier 1.
Okay, great. Another question, and it may seem simple, but I think it's one that's on a lot of people's mind. Christine asks, if we've had COVID-19 already or tested positive, do we need to get a vaccine?
The CDC does recommend that you get the vaccine, even if you have had COVID COVID-19 illness. You may not, if you've had COVID-19, if you've been diagnosed with COVID-19 within the last 90 days, you don't need to rush out and get it. You're still probably have pretty good immunity. But after that 90 days, if you're encouraged to go ahead and get the vaccine.
Okay. And I guess the other question is, some people are asking, will people eventually be required to take the vaccine? I know there's been a lot of discussion about that. Anybody want to take that one on?
I have not heard that so far, and so I can't tell you if that's going to happen in the future, but I've not heard anything like that currently. Dr. Mace or Lindsay, you know, if you've got something else, let me know. But
yeah, I know there hasn't been any discussion about that at this point. I know, particularly in light of the fact that it was authorized through emergency authorization, they were really avoiding that. Let's go to Julie Johnson. You had a follow-up, Julie?
I do. Thank you. I heard we are experiencing another significant uptick in cases at long-term care facilities. The number I was given is 22 different facilities reporting new cases recently among residents and staff. And I'm wondering, you know, what data you might have about this, and I'm wondering how the county might get involved.
Yeah, thank you, Julie, for that question. So we are involved with our residential care facilities and our skilled nursing facilities. We have regular calls with them. As I said, we early on provided a lot of assistance with the state in terms of the infection control practices, helping the facilities with cohorting patients, how to decide when to transfer them to hospital or to back to the facility. And we're continuing to work with them. I don't know if Kate has any of the data to show. I know we are seeing an increase in cases as we are seeing throughout the county and throughout our community. But Kate, did you have any more specific information?
So yeah, as Dr. May said, we definitely are seeing an uptick in cases. The weekly numbers on that will be refreshed by our team tomorrow is usually when those updates come out. So I can be sure to follow up with you, Julie, if you would like, and provide those numbers. They're also posted on our dashboard in terms of numbers of cases. When I last looked at the state data, I did see that somewhere between 20 and 25% of our skilled nursing facilities did have active cases that they were reporting. But I can get you those exact numbers and make sure it's the most up-to-date information if that would be helpful.
Yeah, thank you so much. And just a quick follow-up for Dr. Mace. At what point, you know, we may not be there yet, but at one point would you consider more drastic measures? Like I know you've discussed in the past the concept of creating a COVID long-term care facility. It sounds very logistically complicated, but I'm just, you know, given the rise, I'm wondering what's the trigger point and what are you imagining for the future?
Well, the state actually does have 13 different sites where that are alternate care sites that are available to us if we need. So rather than create our own such site, which, as you know, was had a lot of challenges to find a place with that had no capacity, that, you know, brand new place to put people. I think we'll go potentially, if we need to transfer people to other locations the state has provided. I'm hoping we won't get there. Our facilities have become really good at being able to cohort people and keep them safely separated from one another and work through COVID.
Okay, thank you.
Okay, great. A couple of people have asked questions about isolation. And I know there's been questions about how long we should isolate when we either go out of the area and come back, or if we suspect we might have been near somebody who's COVID positive. Any thoughts on that, Dr. Mace, in terms of direction?
Yeah, and we have to first get the distinction between isolation and quarantine. So if you actually have COVID that's when we ask that you isolate, stay in your own room with a private bath, and don't leave that room for any circumstance and put other people at risk because you actually have COVID. And that's for a period of 10 days minimum. And if you're symptomatic, an additional 24 hours of not having a fever, which for many people works out to be about 10 days. Now, for the quarantine, that guidance is changing. In fact, CDC and CDPH have put out new guidance shortening the period of quarantine to 10 days, which we are going to adopt here in our county. We still tell people that if you have been exposed to COVID and you're identified as a contact, to monitor your symptoms for 14 days, but we at the county will have you quarantine for the 10 days and test around day 8. And if you have a negative test, you can go back to being out of quarantine by day 10. Now, I think what the other question that's being asked is if you travel, let's say, or leave the Bay Area for whatever purpose and may be worried that you've been exposed to COVID either during travel or wherever your destination was, and you come back, we strongly recommend that you self-quarantine and monitor your symptoms. And again, that would be for that 10-day period of time. I don't know, Adam, we looked at this quarantine issue recently with the latest stay-home order from the state. Is there anything else you'd like to add to that?
Not really. The CDPH does have a travel advisory that those who are coming, especially from out of state, are strongly encouraged and recommended to quarantine for the quarantine period, so as to potentially not spread the virus any further. But I would agree with your response.
As a follow-up, one of the Sandy asks whether do you need to isolate after you've been vaccinated? How long does it take, I guess, to take effect? Anybody know?
We're not recommending that you isolate after you get vaccinated. That's not the recommendation.
Okay.
I think I might just add that, there's 2 doses to the vaccine, and the vaccine is going to have maximum efficacy after you've taken the second dose. So just keep that in mind.
Okay. And we have a question asking about, can you talk about the county health COVID testing turnaround times? She's wondering why getting test results is now taking from 4 to 6 days.
So there's different labs that are performing testing. The county's public health lab turnaround time is still 24 to 48 hours. And our most vulnerable populations are being tested through the county through our pop-up testing for that lower socioeconomic census codes and zip codes where we're doing pop-up testing. We're also testing all of our contacts to cases. And when there are outbreaks, we will often also be involved with testing because we need to get those results quickly. Now, if you're talking about OptumServe, which is the fixed sites that are in Windsor, Petaluma, and Santa Rosa, those are the state-run sites, and the testing is done through the state lab. I believe it's in Valencia. And that may be where you're finding a turnaround time of closer to 4 to 6 days by the time you make an appointment, go in, get tested, and get your results. And that, again, is not the county system, it's the state testing system.
Great, thank you. Here's another question about vaccines. After getting the vaccine, will we, Jen asks, after getting the vaccine, will we have to wear a mask, and for how long, if so?
Yes, the answer is yes, yes, yes. We don't know how long. So there's a little difference between protecting yourself from getting symptoms and getting sick from COVID and being able to pass the COVID virus on to somebody else. And what the vaccine trials showed was that the vaccine does a very good job of protecting you from becoming sick and ill with the virus, but it didn't really look at whether or not it protects you from passing on that virus to somebody else. And that's something, another thing that the state and the federal government will be monitoring and watching and seeing. So since we don't know if it has the potential, if you still have the potential to pass on the virus to someone else, the recommendation is that you wear a mask. That's coming from us, that's coming from the state, and that's coming from the Centers for Disease Control.
Yeah, and not just the mask, but also really abide by all of the mitigation measures, the physical or social distancing, the general hygiene measures, because it'll take a while before enough people are vaccinated as well in the community to really suppress transmission of COVID. And during this time, we really need to be careful to ensure we're doing everything to limit the spread of COVID.
Okay, great. Julie had a follow-up question about the doses of the vaccine that are arriving tomorrow and next week. Julie, did you want to ask that? Julie, can you hear me now?
Oh, hi there. Sorry about that. Thank you. I just wanted to triple check again. The doses we're receiving tomorrow, are those first and second doses, or are they still thought to be first doses? And then my follow-up to that is the second shipment of Pfizer expected December 21st. Is that the box of second doses, or is that more first doses, if that makes sense?
I can go ahead and answer that. So the vaccine that's slated to arrive tomorrow is going to be all for covering the first dose. And we were told that the next shipment of vaccine is also to cover the first dose. So we'll still be working our way through Tier 1 healthcare workers with those doses.
Great, thank you.
Okay, this question, maybe we can direct to Adam. Adam, they're asking about the school closures and the debate about reopening them. Andrea asks, why can't we be considering opening our schools while we remain in Tier 1 and helping our school districts to reopen? Do you have thoughts on that? Or Dr. Mace?
Yeah, so we're following the state order. What the state order says is that schools cannot completely reopen in counties that are in the purple tier unless they obtain a waiver to reopen. Schools are allowed to reopen once the county is in the red tier for at least 14 days, which, you know, we have yet to reach the red tier. So at this point, we still remain in the purple tier. So schools cannot reopen without a waiver. And now, as part of the governor's emergency break to try to rein in as much as possible the spread of this virus, the state is advising against granting any additional waivers in counties where the new cases per day, as a part of a 7-day average per 100,000, is 14 or more, which we currently are in. So we are following the recommendation of the state to not grant any further waivers until the case rate falls below that number at this time.
Great, thank you, Adam. Adam is our deputy county counsel who specializes in these points, and we really appreciate you being on with us. Let me end on this. Let's end on this question from Mindy. Are you all going to take the vaccine? And if so, will you do it publicly? And I guess I'll be the first to answer. I very much am eager to get the vaccine. I have a wife who's a nurse. She's eager to get the vaccine. She'll probably get it before I do. I have a senior mother who's in a residential care facility, and I'm eager to protect her as much as possible. I want her to get the vaccine, and my 2 kids are eager to get it as well. So I don't know if anybody else have thoughts on that. Dr. Mace?
Yeah, I will absolutely get the vaccine when my turn or our tier comes. We in public health are somewhere near the front. I'm sure Dr. Baldwin can clarify, but we're not the first tier people to get it. But I'm happy to get it, and I'm happy to do that in public so that everybody can see that we think the vaccine is safe, effective, and something that everybody should get.
I'm going to get the vaccine, and whenever our turn is up, which I believe is in tier 2, so not too far from now, I'll be getting the vaccine, and I would do it publicly.
Well, maybe we can coordinate it and do it during one of our briefings. I think that'd be great. Okay. Well, listen, let's we're gonna draw it to a close at this point. I just want to thank all of our crew who help us out as always. Stuart and Sylvia, our producers, Jordy, our Spanish interpreter, and Elizabeth, our ASL interpreter. And most of all, I thank Drs. Mace and Dr. Baldwin, Kate Pack, our health program manager, Sonoma County's epidemiological team, Adam Radke, our deputy counsel, and everybody else who has been able to join us. We encourage you all to like the County of Sonoma County, the Sonoma County Facebook page, and follow us on Twitter. And be sure to invite your friends. It's a lot of information goes out there. We have 9 or 10 social media posts just today and yesterday. So please follow us and join us again each Wednesday for these live briefings at 3:30. Until then, have a good week and stay safe and get vaccinated when your time comes. So thank you all.